Use of Cannabis Derivatives in Cancer Patients. A book written by Pharmacology University. Narrated by Sandra Loaiza. Introduction. The cell is the morphological and functional unit of every living being. The cell constitutes the smallest form of biological organization. They can grow to become stem cells and thus divide by two processes: mitosis, which gives rise to two new identical daughter cells, and meiosis, which forms four daughter cells different from each other with half of the genetic code of the mother cell. Generally, the cells die by apoptosis and are replaced by new ones. Genetically, the cells are prepared to fulfill their cycle and purpose. When an event alters this program, it causes detrimental effects for the organism that composes it, as in the case of cancer. Cancer is a broad term used to describe diseases in which abnormal cells multiply uncontrollably and invade other tissues, causing metastasis and high morbidity and mortality rates. It is defined as the loss of control of an organized system, where cells alter by losing the apoptosis program, or cell suicide resulting in this dreaded and lethal disease. Epidemiologically, cancer is considered one of the leading causes of death worldwide, with an estimated 10 million deaths by 2020. The economic impact of cancer is nearly $1 trillion annually, not counting the human cost in terms of suffering. This is the reason why in the second half of the 20th century, oncologists focused on adjuvant therapies, together with treatments to eliminate the tumor and destroy the remaining cancer cells at the same time. Among the adjuvant treatments to reduce this pathology, we find the derivatives of cannabis sativa, demonstrating in many studies its beneficial effect for this type of patients. This is why research is increasingly being focused on understanding the important biological role of the endocannabinoid system, ECS, in physiological and pathophysiological processes. Likewise, many groups of research worldwide are creating new pharmacological agents for treating cancer. Recently, cannabinoids and endocannabinoids have attracted a great deal of interest in the scientific community because delta-9 tetrahydrocannabinol, delta-9 THC, has demonstrated to have antineoplastic activity, which is also present in endocannabinoids. The progress of medical research will determine the possible pharmacological considerations to define cannabis-derived molecules as an adjuvant in the treatment of pathologies such as cancer. For this reason, this audiobook will explore in more detail what this disease consists of, what its consequences are, to evaluate the role that the use of phytocannabinoids may have in the progression of cancer. Chapter 1.
Sample complete. Ready to continue?